Hello everyone. My name is Deborah Bell, and I am the Director of Education for the Osher Center for Integrative Health at UW. And I'm going to start with a little welcoming presentation here. Uh, so, um, this is our part three of a women's health series. And today we're going to be talking about mental health, compassion across the life stages, and we have two presenters today, Dr. Rachel Turow and Dr. Leslie Butterfield. And I want to say a little bit about our Osher Center. Our physical center is embedded in the UW Ballard Sports Medicine Clinic. And so we have some clinical services there. And also, many of our providers are also practicing embedded in one of the UW primary care clinics, either at Northgate for myself and some of the acupuncturists, and at UW Factoria for our director, Iman Maj, and one of our acupuncturist naturopaths. So this is our part three of this year's topic for our Chachi Ming seminars with Dr. Rachel Turow and Dr. Leslie Butterfield. And I'll say more about them in our presentations in a moment. But as I said, here's our little slide for the clinical component of the Osher Center. Our other arms are our education arm and our research. And the Osher Center, as I said, is one of 10 national academic institutions that have an Osher Center, and we also have one in Sweden, the Karolinska Institute. And the Osher Collaborative is the organization of all of the Osher centers. And so we do have some activities that all of the Osher centers participate in, and we all collaborate with each other. Uh, the Chachi Ming endowment, we are very grateful to have funding from the philanthropist of Mr. Chachi Ming and his legacy, and his family continues to support our Osher Center. And without their gift, it would be difficult for us to share this for you at no cost. And if you are interested in helping to support the Osher Center, there is a link for that on our website, and we appreciate everyone's support. This is me. I don't need to say more about myself. Dr. Rachel Turow will be speaking today on the topic of self-criticism versus self-compassion, science and practice perspective. And Dr. Turow is a clinical psychologist. She also is a faculty member at Seattle University and at the Icahn School of Medicine at Mount Sinai, author of the book, The Self-Talk Workout, 6 Science-Based Strategies to Dissolve Self-Criticism and Transform the Voice in Your Head. And she will begin, and after her talk will be Dr. Leslie Butterfield, who will be speaking about perinatal mental health and beyond. She's a perinatal psychologist with over 25 years of experience supporting families through the transition to parenthood. Her work focuses on perinatal mood and anxiety disorders, which we will hear the acronym PMADS, perinatal loss, recovery from traumatic birth, neonatal intensive care unit parenting, and caring for medically fragile infants. She trains professionals across the U.S. and internationally through Postpartum Support International and Perinatal Support Washington. Dr. Butterfield has authored numerous articles and is contributing a chapter on perinatal EMDR to an upcoming book. So we thank our presenters in advance. I also would like to thank Carolyn Kim, who's the person for which we could not have this happen without, is our administrator to help with all of this, and also our director, Dr. Maj, who very graciously told me that I was no longer that I wasn't sharing my slides. And with that, I'd like to invite Dr. Turow to begin our program for today.
Thank you so much, Deborah, and thanks to you all for joining us today. I have worked with patients from teenagers to older adults. And right now I'm teaching at Seattle University, so my folks are primarily undergraduate students. And I teach three classes there: mindfulness skills, building resilience, and developing compassion. My students have agreed for me to share some of their experiences anonymously to illustrate some of these experiences that I'll speak about with you today. I'm not using PowerPoint right now, but I wanted to assure you all that you will be emailed handouts by our wonderful hosts and organizers today. And the reason for that is that today's session isn't just about learning information. I'll also give you the opportunity to try out some of these skills that I'll discuss in the moment. And that's because, as a scientist, I want to share with you that the evidence shows that supervised skills practice, actually trying out new things, seems to be more effective than just learning about the skills didactically. They're still optional, so if you don't want to do them, you don't have to do them, or maybe you have a better one to do. But I will be providing the moments where you can try them out if you like. And for most of them, you can even close your eyes and try them out if you like. So the first one that I'll just invite us all to do together is called Wishing Well. So we really appreciate that you've taken time from your day to be here, and I'll just invite you to take this moment to wish yourself well, to hope that the rest of your day goes well, the rest of your month, all the stuff that you have to do, the stuff that's on your mind, may it all unfold as well as can be. And this is a little bit more than a hope that things go well. If you like, you can add a sort of flavor of kindness, just like for people you really care about. You want their lives to go well and their days to go well. Can you sort of combine some of that kindness into your good wish for yourself right now? And then, if you've wished yourself well, I'll invite you to send good wishes to anybody else who's on your mind, like your friends, your colleagues, your patients, students, family members, neighbors. May all of their days go well. May their lives go well. We can send wishes to everyone else who's on the call with us today. May all of your lives go really well. May your days go well today. And then, if you like, you can keep going and send good wishes to all beings, excluding none. So that was one way of relating to ourselves in the moment and relating to the people around us or in the world in the moment. And part of what we'll be thinking about in the next several minutes is, how do you relate to yourself? We all have a relationship with ourselves, and we can kind of check on it and see how it's going and see if there are ways where we could even improve that relationship. I've been curious about self-criticism for a really long time. When you train to be a clinical psychologist, you learn about different mental health issues and conditions, and we learn about depression. And it turns out that feeling bad about yourself is often a symptom of depression. Self-criticism is very common among people who are depressed. And what I was surprised about as I continued to train and practice as a clinical psychologist is that self-criticism doesn't only show up with moderate to severe depression, it shows up in a lot of situations. And I sat with more and more patients, and I got more and more curious. Patients often feel so bad about feeling bad that it's hard to get to the other material, because that style of strong self-blame and self-judgment can just be so pervasive. People can even be depressed about feeling depressed, or depressed about feeling anxious, anxious about feeling anxious, just hate their feelings and just be upset that they're having the feelings in the first place. And so many of my patients would say things like, I shouldn't feel this way, apologize for crying in a therapy session, or convey that something is wrong with them for having just basic normal human feelings. And I became really curious over the years about how much harm was caused by self-criticism itself, not just as a symptom of a mental health issue, but what if self-criticism were more like a risk factor, an underlying habit that can affect a lot of other situations and feelings? And I was also interested in which strategies for managing it were effective. So I kind of, took a deep dive and I really nerded out on self-criticism. And it turns out there's a fabulous, strong, robust research literature. So, if you're curious, you can go on Google Scholar and PubMed and find a lot of articles. And I'll give you the summary today, which is that harsh self-criticism is strongly linked with more depression, anxiety, stress, PTSD, eating disorders, substance use, self-harm, and poorer relationships. So it's a risk factor affecting many, many different outcomes and circumstances. I hear a lot of people, including my students, say, I've always been my own worst critic. And when they say that, there's this flavor like it's just something, indelible about them, like their height or their eye color. But the research is very clear that environmental factors like childhood abuse, social media, racism, sexism, homophobia, competitive environments, that all of those impact self-criticism. And also, the evidence shows that the habit of self-criticism can be changed. A lot of people assume that self-criticism is motivating, but actually the research demonstrates it's associated with less motivation and more procrastination. And I've mentioned self-criticism with the word habit. It turns out that self-criticism is a really powerful habit. And there were some researchers who developed something called the Habit Index of Negative Thinking to assess whether thinking negatively about yourself is something that you do frequently, automatically, or unintentionally, something that just happens even if you're not doing it on purpose. Because most of us don't wake up in the morning and say, okay, I'm going to start putting myself down for my looks. Then I'll put myself down because I'm not advancing fast enough at work. And then I'm really going to put myself down about my relationships. It's just something that seems to happen automatically. Like, oh, I shouldn't have said that. I should have done this. And it might not even happen in words, but it can be a habitual way of relating to yourself. And what the researchers did next that I think is so cool is they tried to assess whether the habit of self-criticism was really damaging or the content. And I think as therapists, those of us who are therapists, we really sometimes get into the content of the self-criticism. You might evaluate, like, okay, how true is this criticism about myself? Maybe it's not really true. Maybe I should try to find contradictory evidence. But in this research study with over 1,000 people, the researchers measured both the depressive or, self-critical thoughts themselves, but they also measured the habit of how often it was happening. And it turns out that the habit of self-criticism predicted depression and anxiety even beyond the content of the negative thoughts themselves as measured by the dysfunctional attitude scale. And I think that's really important because so many of my patients, or just friends, people when you talk to people about self-criticism, say something like, I should really be nicer to myself, which is a beautiful aspiration. But changing a mental habit that might have been happening for years or decades is really difficult because our brains learn from experience and repetition. And most of us repeat over and over again this negative information about ourselves so that that self-criticism becomes habitual. So that's self-criticism. But if you look at self-compassion, okay, what does that word mean? You probably heard it around. It's kind of the new mindfulness. Self-compassion is this quality of being a kind, encouraging friend to yourself in any circumstance. And there's some amazing research on this that's really taken off over the past couple of decades. Self-compassion, this tendency to treat yourself in a kind or encouraging way, is linked to better mental health across many different mental health outcomes. It's linked to secure attachment, to supportive parenting, stronger friendships, and stronger romantic relationships. Self-compassion isn't the same as self-esteem or thinking positive. With self-esteem, which was really big in the 80s when I was a kid, self-esteem is still evaluative. It's about assessing how good you are at something. And even if you assess that you're wonderful at everything, if you have great self-esteem, you're still in this habit of evaluating how good you are. And that habit can be pretty rocky. It's an unstable habit because, like a lot of my students, they might have been one of the top students in high school, but then it doesn't feel the same way in college. And if that's how they were getting their, the evaluation, the self-esteem, so that they could feel good about themselves, it sort of, falls away. And then they're left with, well, how can I feel good about myself without the same academic achievement? So self-compassion doesn't depend on anything external. It's really robust because it's just about being kind and encouraging in any circumstance. It's not exactly the opposite of self-criticism, but they're negatively correlated. And you can think of that kind of like the components of the food you eat. The more healthy food you eat, the less likely you are to be taking in nutrients from food that isn't healthy or might be damaging. So, self compassion is an alternative way of relating to yourself. And some people are more self compassionate than others, but it does seem that you can change your levels of self compassion over time and with intentional practice. So, digging deeply into that research, there are several ways to reduce self criticism and increase self compassion. There are programs online or in person that last 6 to 8 weeks, 12-week programs, and those include ones called mindful self compassion or MSC. There's compassion cultivation training, CCT, compassion focused therapy, which is usually an individually oriented therapy. And it turns out that you can also change your levels of compassion through regular old mindfulness meditation or through loving kindness meditation. And I'll explain those more in a few minutes. There are also other forms of psychotherapy that do seem to improve self-criticism and build more self-compassion, including CBT, cognitive behavioral therapy, mindfulness-based stress reduction, and cognitive processing therapy. So there seem to be several different methods to reduce self-criticism and to promote self-compassion. And I was kind of curious about, well, what kind of a dose do you need? How much practice could be helpful? So at Seattle University, I implemented a 4-week group that just met 4 times. 22 students were involved in that group over a 2-year period. And I sort of, took some of the different approaches from the therapies that had been shown to be effective. And just those 4 weeks led to students reporting significant reductions in self-criticism and as well reductions in anxiety and depression. So that was a group in the counseling center. The next sort of step for me was that I started to teach in the psychology department, to teach these skills as academic classes with 8 different modules in mindfulness, compassion, and resilience that all addressed to some degree this issue of self-criticism and self-compassion. And I've had a lot of athletes in my classes, which is really great because athletes really understand the power of repetition and practice if you want to change how you're doing something. So I'm very much somebody who's always telling students to do the reps, that the practice of actually trying out different techniques might be stronger than that intention of, I should really be nicer to myself. So I'll invite you to try out some techniques right now if you're in the mood. And this first one you can do with your eyes closed, or you can take out a piece of paper and a pencil or open a new file on your phone or computer. It's called Spot the Success. I'll invite you to write down 10 actions that you took today. So just today, to either help your own life, someone else, or the world. It's kind of like a to-do list, but it's stuff that you've already done. There's no item too small, even if it seems insignificant or obvious. So you might have written an email today or texted your friend. You might have made breakfast for yourself or someone else. Maybe you got out of bed. So I'll just give you a minute on your own time to write down these 10 things that you did today to spot the success. And you don't have to write anything with your fingers. You can even just kind of think it over. Some of the things that you've done today that have been helpful. You might just check in with yourself. What does it feel like to acknowledge these things? Do you have the urge to just dismiss it? Like, oh yeah, but that was no big deal. I just needed to take the garbage out. Well, sure, I got out of bed. Of course, I took a shower. That's just regular. And you can notice that urge to dismiss, but if instead you can invite yourself to sort of marinate in the feeling of, yeah, I did do that. And I did that. And I did that. Right. And I did that thing too. You're sort of changing your brain from somebody who's convincing yourself, I haven't done enough, to somebody who is noticing and appreciating what you have done. It's sort of like a gratitude list, but you're taking a moment to actually be grateful for your own actions. So when I look at some of the things that students have said after working on this um, exercise for a few weeks, one student wrote, "It felt trivial when I started, but as time passed, it made me feel as though my days were valuable and productive. It also helped when I felt unmotivated because it would show me how much I actually did and sometimes motivate me to do even more." Another student wrote, "It made me feel accomplished and grateful, even on bad days." So I think that one really resonates for me. I think it's really lovely. It's not saying that it's going to solve everything, but you can train your brain to just respond slightly differently in terms of how you're treating yourself. Meditation is another really powerful way to change the tendency of self-criticism. And I know you've heard about meditation. A lot of people might not enjoy it, but I don't really enjoy doing planks at all. I mean, I say if you want a minute to be the longest minute of your life, like get in plank position. I do it to get stronger. And meditation practice can help people's brains get stronger in terms of attentional control, moving your attention, and in terms of relating to yourself with less judgment. And my students find meditation really hard at first, and I found it really hard at first. I don't know that I find it any less difficult now, but I am less judgmental. There's a learning curve with meditation that if you sit down and try to pay attention to just this moment on purpose, it's really hard. And most of my students, most people I know, we want to run away from things that are hard. So meditation is sort of like a laboratory where you can experiment with self-criticism. What often happens is that the mind runs in a lot of different directions, and we have the task of noticing that our mind has drifted and returning it back to your chosen object of attention, such as the breath. That might happen 1,000 times. And I ask my students to shift instead of trying to keep their focus. How about treating yourself as kindly as possible when it wanders? So your mind wanders, you bring it back kindly. It wanders again, you bring it back kindly. It wanders again, you bring it back kindly, over and over and over again, with as little judgment as possible. So actually, you're training attention and non-judgment simultaneously. It's like cross-training for your mind. Yeah, it can be kind of difficult. You might not like it, but I don't like those planks either. So students really want to get down on themselves or meditation, and nobody is forced to meditate. You don't have to meditate if you don't want to, but maybe we could think about it just in this moment, not as something where you have to clear your mind or you have to get peaceful, but just as a mental exercise of trying not to judge your mind when it wanders. And if you'd like to try this out with me, it will only be 10 breaths long. So I'm not asking you to meditate for 45 minutes, just for 10 breaths. So if you'd like to do this, I'll invite you to get into a comfortable position and to pay attention to your breath for 10 breaths. For most of us, our mind will wander away and we'll try to bring it back, maybe 20 times, maybe 100 times. So I'll just try to put a silent minute here now where you can notice your breathing and bring your attention back kindly when it wanders. So I'll invite you to kind of come back to our shared space now. So that was meditation. If you tried it out, meditation isn't about arriving in any particular state, but just trying to be present in this moment on purpose in a non-judgmental way. And if you meditated just now, you can put it on your spot the success list. Here's what one of my students said after trying this for several weeks. Toward the beginning of my mindfulness practice, I would get upset with myself for not being able to focus on my breathing for a long period of time, which would lead to more self-deprecating thoughts. But I have learned to treat the times when my mind wanders not as bad things, but simply just as things that occur. I have tried to bring this into more of my everyday thinking. It has definitely helped me talk and think to myself in a nicer and more understanding way. So you don't even have to think about it as a meditation or mindfulness practice. You could think of it as non-judgment practice. And your mind actually has to wander away in order for you to try out a new way of relating to yourself with less judgment. And you don't have to meditate. You don't have to do it that way. Here's another way to practice where I'll just invite you right now to tune into your breath. And as you breathe, to say something like, inhale, my friend. Exhale, my friend. So this one is just one breath long. Inhale, my friend. Exhale, my friend. This one's super portable. I like to do it right when I wake up. Inhale, my friend. Exhale, my friend. My students like this one a lot. One person says that afterwards, I feel much less angry, less easily frustrated. I have practiced it quite often, and it has shifted my entire mindset as I start finals week. So that's another one that you can try out. There is a technique called the self-compassion break, and the psychologist Kristen Neff is sort of a pioneer for studying self-compassion scientifically. And she suggests this exercise that has three parts. You acknowledge a difficult situation or feeling. Instead of thinking that there's something wrong with you, you think about how all of us have difficult things that we're dealing with, difficult parts of ourselves, and then we try to relate to ourselves with some kindness or support. So, like all of these exercises, I wouldn't start with that most difficult thing in your life, but maybe there's a situation that's just a little bit difficult. Maybe you have a difficult neighbor or a relative, and or so there's something that's challenging in your life. I'll invite you to just acknowledge that, yeah, that is kind of difficult. And now, can you try to see that as part of being human instead of a sign that there's something wrong with you or wrong with your life? Just, yeah, that's part of what we're doing here. We all have some difficult things we're dealing with. And then the last step is kindness. Can you say, yeah, I really want to support myself through this. I'd like to try to be kind to myself as I'm dealing with this. My students one of them wrote, I think the most notable part about these breaks is that I was not exchanging my negative emotions for positive ones. I was feeling both. I acknowledge that even though I might be feeling stressed and sad right now, I still deserve to show myself compassion. And I just have one more that I'll share with you. It's another form of meditation. So there are different techniques for meditation, and one of them is kind of tuning into the breath, bringing your mind back when it wanders. And this one is called loving kindness meditation. It's abbreviated LKM if you want to look into the research literature. And it involves silently repeating phrases to yourself, like wishing yourself well, sort of like we did at the beginning of today's session. So, for example, some phrases you might repeat, matched to the breath if you like, are may I be safe, may I be happy, may I be healthy, may I live with ease. Sometimes students have the idea that these are affirmations, and I don't think they're quite affirmations because affirmations might have that evaluative component where you're convincing yourself there's something good about yourself or that some good things are going to happen. These are good wishes, wishes with kindness, but they're not forecasting the future. We don't know if things are going to go the way that we want them to go today, but we can wish ourselves well. We can say, may I be safe. May I be happy. May I be healthy. May I live with ease. May things not be quite so much of a struggle. And you can repeat those phrases over and over to yourself, or, sometimes the phrases can sound cheesy or awkward or wrong. Maybe you want to do them in a different language besides English. So you can kind of play around with, may I feel peaceful. May I be content. May I feel connected to other people. You can choose some phrases, and I'll just again put a little bit of a space here for you to be silent and send yourself some specific good wishes. And you can check in with yourself now. How does it feel to send those kind wishes to yourself? Some people say it doesn't really feel like anything, but the evidence is really strong that people notice improvements over weeks or months of practice. So I'm going to start wrapping up here. I just wanted to put in another little bit of encouragement that there's some great research out there right now on self-compassion techniques if you want to learn more about this. It does turn out that doing the reps, putting in the practice makes a really big, statistically significant difference. And I do have some other materials to recommend. There is the UCLA MARC Mindful Awareness Research Center website. They have lovely meditations. There's a resource called Insight Timer. There's the Calm app, the Headspace app. So we have a lot of information, and I have a book out there called The Self-Talk Workout that goes into some of these strategies in greater depth. I really appreciate your sharing your time and energy with me today and with all of us. And I really welcome your questions or comments if you want to get in touch.
Thank you so much, Dr. Turow. It's really wonderful to have both the experience of the exercises as well as hearing about the science. And in the nature of respecting everyone's time, I'm going to invite Dr. Leslie Butterfield to come on to the video, and we'll just go right into your presentation. And when she's done, we'll have a dialogue question and answer for towards the end. So welcome, Dr. Butterfield.
Thank you. And I'm super glad to be here. There's so much to say about this topic. And Rachel, the whole time you were talking, I was really thinking, oh, this would be so useful for a perinatal family. I could just see so many new parents using that spotting success to actually know they're doing a great job when they're not feeling like they are. So many things that you talked about, I think, are super applicable to the perinatal time period. I also want to say that I'm very aware that fathers and other partners may have very similar perinatal experiences. I'm really basing most of what I talk about today on the research that is about women who are giving birth and their perinatal experience. But I think it's important to keep in the back of our mind, how might this be true for a father? How might this be true for another partner? Just to kind of open our hearts and our compassion to all the members of the family or related community that might be working with this mom. So, when we look at women's reproductive life experiences through the integrative lens, the first thing that really stands out to me is how many occasions of reproductive experience or change occur across a woman's lifetime. Many opportunities for all these different biological, emotional, spiritual changes to emerge, become more important, perhaps stay important, or maybe fade into the background as another change comes forward. And when we think about all those different reproductive experiences, each and every one of them can really be looked at through this multivariate context where people have very emotional experiences. They may have different cognitive processing happening or different cognitions about what is happening to them, what their experience is. Of course, there's a profound genetic and biological component of almost all these reproductive experiences. There's the experience of the physical embodiment of these hormonal changes and what is happening internally to the body and how that feels in the body, what the sensations are in the body. And then there's even the kind of existential questions around what's happening to me and what am I supposed to do about it? And as this change occurs, how does this change my life pathway or where I belong in the world and how I function in the world? So, a very existential approach. And often that is occurring hand in hand with spiritual questions. How do I move into this new role? How do I fulfill myself spiritually or fit into my community as I change from a girl to a woman, as I change from a woman to a mother, as I change from a child producing woman to a child rearing woman, and then to someone who is beyond that, then how do I manifest the cognitive or the spiritual nature of these things? But most of all, and underpinning all of these other things, is the interpersonal context, because everything occurs within interpersonal relationships. The harms that can be done occur interpersonally, but the growth that can happen, the affection, the attachment, all these things that happen, the way we make meaning of who we are and what we're doing in life, all of this totally occurs within an interpersonal context. Can you imagine anything in life that is more relational than creating a human being, sheltering it with your own body, giving birth, and then taking responsibility for the life of that new person. Again, partly by caring for them with your own body, your own time, your own psyche, your own moral stance. All of these things we give to our children and learn from our children. So that the sharing of one's body and what we give to our children is constantly and forever and always, even after the perinatal period, something that's very directly interpersonal. We know that new parenthood is really full of themes that emerge for people, themes around identity and belonging, and themes about interpersonal relationships and the impact that the perinatal time period is having on those relationships. Identity is very existential in nature, and every person becoming a parent for the first time really does experience an existential identity crisis. But as a culture, our culture in particular, is not very good at acknowledging the depth of the existential questioning and change that happens. And it is really the task of a culture to help the new parent view their new role, their new skills, their new capacities as something that deepens and enriches their life, as opposed to something that robs them of identity and leaves them empty and depressed. Many, many other cultures do practice a 40-day time period after birth, where the mom in particular, but both of the parents, are treated with special foods, special talks, special behaviors, caregiving, mentoring that allow them some very focused time and physical care to begin to make these shifts in their own minds and their own behaviors. And I still do think that in our culture today, that this existential change is experienced more strongly by the mother than by the father. This, of course, is not true for everybody, but because of the combination of physical change, biological, emotional, task-oriented things, it is often the mother who is doing more changing and adjusting. But in addition to being existential, identity is also very interpersonal. And the schema, the belief system that we form about what do relationships mean? What kind of things can I count on? And what kind of things am I supposed to provide? We form those schema early on within relationships, of course, relationships to our caregivers, to our siblings, to the greater family or relations that surround us. And so the impact of those relationships, they do linger in our behaviors, in our belief systems, and they continue to shape us even as we go through significant changes in our life. Now, we also are learning new things, meeting new people, having new and different interactions, which sometimes is great and sometimes can be more challenging or difficult. And we take on these new identities as well. But it's important to remember that the perinatal time period is a bit unusual in the sense that since all of us have been babies and children, we all bring our interpersonal past to the table when we have our own children. And these old relationships and old schemas may help us or may make it more difficult for us as we begin a new relationship with a new person that we are going to be very responsible for and spend a lot of time with. So, in thinking about the relationship changes that occur in the perinatal time period, we see that these changes are both a reflection and a cause of some significant losses that occur interpersonally. And these relationship changes might contribute to adaptive change during the perinatal period, or they might contribute to development of a perinatal mood and anxiety disorder or a PMAD. They may be a result of the same thing. So there is that intertwining cycle that is quite complex, actually, and that just continues to go on through the perinatal time period, which for general medical information or therapeutic diagnosing and things like that, the perinatal time period is considered to last from conception to 1 year postpartum. Unofficially, most of us who work in the field say it lasts forever. You really never let go of those people or those things that are coming into your life and changing it at that time period. And even if you're the mother of a 3-year-old or an 8-year-old or a 15-year-old or a 30-year-old, it is still possible to learn new things that help us to reflect on the past, perhaps give us an opportunity to share with our partner, with our children who might even be adults having children of their own, information and ways to understand things that can still make a difference when we reflect on our own parenting and our own childhood. So it's never too late to really think about these things, but officially it's over at 1 year after the child's birth. Perinatal mood and anxiety disorders, or PMADs, are the most common complication of pregnancy. We currently are estimating about 20% of birthing people worldwide, this is global, will experience either a single PMAD or more frequently a combination of PMAD. Depression and anxiety go together a lot. General anxiety and OCD may go together. Bipolar disorder often coexists with psychosis, even though psychosis postpartum is quite rare. Anxiety and post-traumatic stress disorder coexist. So we really should be on the lookout for these things because they're happening to 1/5 of the people who give birth. And even though it's not a point of discussion today, we look also at partners and husbands, and we find that as the rate of PMADs goes up for the birthing women, it also goes up for partners and fathers because they're in relationship with someone who is suffering. We do see that children are impacted and that one can find evidence of emotional and behavioral difficulties in children when there's untreated PMAD in the parents. And PMADs have a lot of contributing factors, although many of the factors do have that interpersonal element. There's possibility of a past history of neglectful or abusive or violent behavior. There might be medical trauma that has occurred. And just so you know, when people talk about medical trauma, whether it's at birth or any other medical event, it's often the interpersonal interactions that they've experienced with the medical staff that cause them to move from this was difficult, challenging, painful, I didn't like it, to this was traumatic, horrendous, and awful. That interpersonal piece is the bridge that makes the difference. When people already have a history of pregnancy loss, so their relationship to a pregnancy or a child is already changed by that prior loss. If there's poor treatment, interpersonal treatment during pregnancy or birth, if there's a difficult or lengthy NICU stay, especially when the parent is uncertain whether the baby is going to live through the treatment or the condition, so there's an impending significant interpersonal loss in the background. People who have prior histories of depression or anxiety already are more psychologically and physiologically vulnerable to a PMAD. And mostly, I just want you to hear and kind of think about the importance of that interpersonal relationship and think about how one of these PMADs, a mood or anxiety disorder, might arise because of interpersonal changes that are being experienced and that are disruptive. And also how when somebody develops a PMAD, they may behave differently or think differently about relationship. And that too is very disruptive and may change their life in significant ways. Very, very few relationships go unchanged when you have a baby. First of all, the relationship to your own mind and your own body changes, and that can be very challenging for people, depending on how important those things are to them. Some people are very sensitive about body image, body appearance, how their body feels. And for other people, that would not be an issue at all. It might be something else. New parents, usually people who are competent in other areas of life, particularly in the workplace, as mothers are becoming pregnant older and older, instead of giving birth at 22 or 23, many women are giving birth at 32 or 35. They have a much longer history of becoming very good in the workplace, very competent, very efficient. And then they have to learn a whole new set of skills. It's really not about competency and efficiency in the beginning. It's about relationship. It's about listening. It's about empathic understanding. It's about making your best guess of what's happening, trying to solve it. And if that doesn't work, recognizing, I just need to go back to the drawing board versus, oh, I'm a terrible mom. I can't do this. So being an adult learner is hard. We want it to be quick. We want to be really functioning at our highest point immediately for this very important job. But becoming a parent is a process. It doesn't happen overnight. There's a lot of learning to be done. A lot of mistakes are made. Thankfully, repairs are pretty easy, but it's a lot of work. So this is one significant relational change that happens. There are also challenges to our role. who am I? What do I do? How am I known? And what do I even call myself? Am I a daughter, or am I a mother, or am I a friend? These things get a bit more blurred. And often the relationship to the new baby takes precedence for quite a long while until sleeping and feeding is established and people have a sense that, okay, I think I might be able to do this. So, what happens to women when the new mommy role kind of eclipses all the other roles they have? And their new role doesn't even feel safe yet. They don't feel good enough. They're not doing well enough. Here's where some of Rachel's work really comes in. Well, here's what happens: anger, panic, sadness, and depression, frantic, trying to do everything at once, but not feeling good about anything. And even your basic partnership with a spouse or just a partner are also changed. People who feel really connected during a pregnancy, and that may not be everybody, but people who do feel connected suddenly feel unconnected after the baby is born. They have been in a two-person system. Now it's a three-person system. Everything's out of balance. You're relating differently to the partner. You don't even have time to relate to the partner. Um, many changes in sexual functioning and sexual connection, so that something that used to be bringing the partnership together either isn't happening or doesn't feel the same, is more fraught with anxiety. And the bids for connection that we usually offer to each other, really 50, 100, 150 times a day, little tiny things where we acknowledge our partner, say something kind, pat them on the shoulder, give them a smile, show them a cartoon from the newspaper. All of a sudden, that's gone. And it's the baby that's getting all the bids for connection. Our friendships are changed. There's a lot of friendship loss with people who have not had children and who don't know what you're talking about or how your life is so different. It can feel very lonely, and it's super important to be able to make some new friends who share the time of life that you're in, and also to think of some possibilities for maintaining old friendships, but maybe doing it in a way that's different from how you've done before children. And even family relationships are changed. Daughters are now mothers. Mothers become grandmothers. Somebody new is the baby of the family. And that's all different. That can bring conflict. It can bring new understanding and new respect. But if you don't expect these changes, they may take you by surprise and they may be disappointing or unnerving. So, again, if people knew in advance, I'm going to need to think about this before the baby comes, maybe even talk to these other people in my family, that would be really wonderful. But even more than change, we're talking about loss of relationships. This is such a lovely quote from Lucy Jones. I really recommend that people look at her article in The Guardian and also look at her book, Matrescence, The Art of Becoming a Mother. She talks about the loneliness and the isolation of a new mother. And we do know that interpersonal isolation is a very common complaint. Loneliness is suggested as perhaps the leading contributor to mental health issues in general, but specifically in the perinatal time period. it has the health equivalent of smoking 15 cigarettes a day in terms of overall physical health. And moms of babies or small children constantly talk about being socially isolated. There's lack of community and social support. I think we're super lucky here in Seattle to have some things like PEPS and Perinatal Support Washington that runs groups for new parents, but in a lot of places they don't have that. So there's a loss of interpersonal connection. There's a lack of social recognition about this huge role change that's happening for someone. There can be breastfeeding difficulties and a lot of interpersonal stigma that happens around that. So how do we best prepare ourselves and others for these relationship and identity problems that accompany new parenthood? They don't have to turn into PMADs. But I think the main message I would give here is that it's important for people to look at these things when they're still pregnant, before they've had a baby. What kind of help are they going to need? How can they practice asking for it? What are their attachment vulnerabilities and when are they likely to be stirred up? How can they work with their partner to make that easier? To learn some stress management, as Rachel was talking about, and to do all this before the birth. And speaking from the side of the people who aren't the birthing person, be proactive. Share yourself, share your time, share your resources and your knowledge, the information you've learned from being a parent yourself. Be a good mentor. We really need that. And be a good friend. Okay, thank you so much.
Thank you very much, Dr. Butterfield. I'm going to invite Dr. Turow to come back on, and we'll spend the last few minutes of our time together in a discussion, sort of question and answer mode. I was writing down just a couple of themes that popped into my mind when I was listening to both of you, and a big thing that you both mentioned was the word relationship. Particularly relationship with self. When we're talking about self-compassion, but with community, with other family members, with one's partner. And also change, making change happening in our life, losses, and noticing what are our emotional responses, what are our emotional habits. And so within that, I think there are a couple of follow-up questions that we've thought of. And this one is directed maybe more specifically to you, Dr. Turow. I think that you mentioned your students and you talked a bit about this, about people being um, about self-esteem versus self-compassion. And so the question is if we work on increasing self-compassion, will this lead to being more selfish or lazy or mean that people have to lower their standards for themselves?
It's a great question, Deborah. A lot of people worry about this, in part because self-compassion can be unfamiliar. And there is this idea that we need self-criticism, otherwise we're just going to be lazy and never accomplish anything. But we do have some evidence showing that actually self-compassion is associated with more encouragement and actually greater competence for work in the helping profession. So medical professionals are rated as more competent if they practice their own mindfulness and self-compassion. I find that really interesting. It does seem to also reduce judgment, not only towards yourself, but towards other people. So it's associated with less biases, fewer biases, less stereotyping. But it's interesting to just kind of experiment for yourself. You can see, kind of like Leslie mentioned, we are in a culture where you have to be good at things, and we expect ourselves to be good at everything. So if you're not good at everything, then it's a huge problem. But that same philosophy would lead you to abandon new things. Whereas if you're self-compassionate, oh yeah, I can try 20 times. If the first 10 times don't go so well, then I'll keep trying again. That is just a really effective way to measure a new task rather than just, refusing altogether or feeling horrible if you're learning something new.
Great, thanks. Yeah, and in terms of research, something that I've been involved with over many years is that there was research many years ago showing that medical students actually had less empathy at the end of their training than when they started. And there was a development of a mind-body medicine elective for medical students that after they learned about loving kindness meditation and other kinds of mindfulness practices and other mind-body medicine practices, the research of these medical student groups showed that they actually had more empathy than when they started. So it is definitely something as a tool, I think, for people in the healing field, can be a model for everyone that these practices are helpful for both our own sense of well-being, but also make us more effective at our relationships with others. Dr. Butterfield, I don't do it anymore, but I used to help pregnant people and catch babies, and have two of my own who are grown men now. But there is the term the baby blues, and you
Mhm.
gave us a statistic about PMADs being 20%. But are those the same? And if they're not the same, could you describe that and how many people actually get the baby blues?
The baby blues are, I'm not sure of the word, they're everywhere. We estimate between 50 to 85% of birthing women do have the baby blues. And usually the baby blues will occur fairly quickly after birth, and they're usually over by about 2 weeks after birth, or even sooner than that. And someone may find herself to be um, tearful or just feeling sad or actually just feeling a shift of moods that is not something she's used to. So the time frame is one of the things that we look at. The other thing we look at is in the baby blues, if someone feels really fatigued and kind of low, and they're able to have a nap and someone brings them a good meal, they have recovery. They feel better. They may then the next day kind of still have changes, but they are responsive to people's caretaking of them. When someone is developing a PMAD, the severity of their experience is usually deeper than someone who's having the baby blues, and they are also less able to make use of the help that's perhaps just offered in general, as many people do, bring a meal or do chores or come by to visit and keep company. Those things maybe just don't provide the same level of comfort that they ordinarily would. Because anybody who's having a new baby is having change and, some stress associated with that and changes of routine and rhythm. But it's more if they cannot seem to adapt and there's not a trajectory of greater success and a better feeling of hopefulness and connection. It just continues to feel not okay and not getting better. Baby blues get better. They're over.
Thanks.
Hmm.
Yeah, this is actually going to be somewhat of a two-part, but related to both of your presentations, which again were just so rich and helpful. Um, Dr. Turow, you mentioned several different kinds of psychotherapeutic techniques, and you mentioned different forms of mindfulness practices and different kinds of self-compassion practices. Um, and I'm just wondering, that you also talked about the association between people struggling with poor self-compassion and depression and anxiety. So, would you want to comment on um, what is happening in the brain with that, and how does that relate to maybe somebody being on a medication? And then, similarly, Dr. Butterfield, there's certainly a lot out now with celebrities and people in the public talking about taking medication for postpartum depression. And so, would you maybe talk about, some specific therapeutic techniques and whether or not everyone should take medication for PMADs or for people who have uh, mild anxiety and depression associated with
Mm.
self-compassion. So that would be, for each of you, that connection. With a lot that people talk about, that this is all about the chemistry of my brain. So as a lead in, what are the changes that happen in the chemistry of your brain just from the techniques of working on self-compassion?
Well, one thing that I really like to point out in the brain is the importance of the corticolimbic pathways. So if you kind of take that fist, that's your limbic system, and you put the other hand on, that's the cortex covering it. And a lot of times when things aren't going well, when we're stressed, the limbic system is like, I'm freaking out. And then you have this cortex that has a lot of thoughts about how to handle it. But for a lot of us, we're not really used to maybe figuring out how these relate to each other, and those pathways might not be so strong. The more you practice managing a strategy that can help calm down the limbic system, you develop these really strong corticolimbic pathways so that the different parts of your brain are talking to each other more effectively. So that's one aspect. Another thing that I'd just like to mention is how the networks of the brain work together. So when you are in what's called the default mode network, that's like, I think we all have like the top 10 greatest hits, of like our worries that play every day or our self-criticisms. We're like, oh yeah, I know that one. Um, but with practices that train your attention, like meditation, you practice shifting the network of brain mechanisms that are activated and working together. So in addition to that default mode network, you have the task positive network. And so when you practice, my mind went away, bringing it back, my mind went away, bringing it back, even if that's annoying or frustrating, it's also really valuable attention training. So when you start to get down on yourself, you can actually say, okay, there it is, I'm bringing it back, and you've practiced it 1,000 times. It just becomes a little bit easier to detach from that self-critical thinking. But that's where practice really makes a big difference. Some people do find that medication is helpful. Interestingly, physical exercise also helps reduce rumination. So there's a lot of different ways to approach this if you don't want to meditate or if you do feel a good response to medication. And I also just want to point out that I do sort of specialized in these individual based approaches. That's a product of my own sort of Western psychology training. But the broader systems and supports or the lack of them, those are so powerful too. So we have so many elements that are working together. But I think it's nice that there are some strategies that you could try: more exercise, more connecting with people, more meditation, more self-compassion, more pleasurable activities. There are a lot of different pathways that can improve your brain and improve your well-being.
Thank you. And Dr. Butterfield, do you want to take it from there on your end?
Sure. I mean, there certainly are people for whom medication is very helpful, but I think it's really important, if possible, to try some other things first. And through the body is a really good place to begin. Just as Rachel said, exercise is really important. And if we can adapt exercise for a new parent and make the possibility of exercises that perhaps they didn't used to do or aren't familiar with, but that they can do with a new infant or with a changed body, it can be very helpful in regulating mood. And if one makes it a social occasion, it can be very helpful in that interpersonal field. But in many, many other countries, some of the things that happen during that 40 days period after a birth is massage.
Hmm.
Massage for the mother and possibly father learning to massage the infant. And what seems to happen with this is that everybody feels better. The
Mhm.
people receiving the massage and the people giving the massage. It's a connection tool. It changes how the brain is working through touch. And there's some nice research about this from Tiffany Fields, who looked at moms with babies in the NICU. And they did an experiment where they learned a very specific massage for babies who are more fragile. And the babies who received it slept better, gained weight more quickly, and went home from the NICU faster. But then the moms all said to her, but I actually felt better too. And then we find that if the father gives the mother a massage, the mother feels even more better. But if she also gives the partner a massage, the whole family feels better.
Better. Yeah.
Yeah.
Well, unfortunately, we're out of time. I would love to continue a dialogue with you for quite some time, but I want to be respectful of everyone's time and the rest of their afternoon. So, thank you both for your really helpful and rich presentations, and thank you to all of our participants. These presentations will be on our website. Within a few weeks, you'll get an email when they're up there. You're welcome to review them. You also can give the website address to any friends who might want to view it. And keep a lookout for future things for 2026. We're just getting a lineup set up, and I appreciate all of your participation, and I hope you have a wonderful rest of your day. Bye bye.